sixth session of my 45-day course. Today we talk about heart failure and cardiomyopathies. Heart failure and cardiomyopathies. They can hear, right? Yeah. Okay. Heart failure. Heart failure is a chronic progressive disease for which there is no specific cure. Heart failure is a chronic progressive disease for which there is no specific cure. And in general public, there are two concepts, two thinking, different people think differently. If you say you have heart failure to some patient who has one, you think that he is going to get heart attack and he's going to get cardiac arrest and he's going to die. So he is scared. Oh, do I have heart failure? I'm going to die. Other group of patients, they think that you have heart. If you tell them that you have heart failure, oh, heart failure, thank God it's not cancer. So that is a thinking. You know, two people think differently, but it is more malignant than cancer. So, because once you diagnose heart failure, the 50 to 60% of the patients will die within first 5 years. And heart failure is not one disease, not a single disease. It's a syndrome complex. It is secondary to many diseases in the heart and outside the heart. You should remember, heart failure can be due to the diseases in the heart, outside the heart also. Some people have some other disease that can lead to heart failure. So heart failure, as I said, is a chronic progressive disease and there is no specific cure. You have treatment like cancer again. Cancer, we have treatment, but no cure. Same thing, heart failure, we have treatment, but no cure. The clinical syndromes, what is the definition? What is the definition of heart failure? Inability of the heart to contract well enough to pump the enough blood to the requirement of the peripheral tissue. Inability for the heart to pump enough blood to meet the metabolic and tissue requirements of the body. The heart is not able to pump enough blood. Heart, that's why it is called heart. We call it heart failure. Again, you may, as a student, you may get confused with various terms that we use, like acute heart failure, chronic heart failure, right heart failure, left heart failure, forward failure, backward failure, high output failure, low output. These all get confused. So now the American Heart Association has removed all these terms. All the time they're calling it as only acute heart failure syndromes and chronic heart failure syndrome. There's only two entities now. Though our books still give the same old terminology, but now the latest is we call it the heart failure. That's all, because there is no right heart failure, left heart failure in isolation. All left heart failures will have some amount of right heart failure, and all right heart failures will have some amount of left heart failure. They're all almost always they're biventricular. One may dominate on the other, but it's almost never one-sided failure. Though it may begin with one-sided failure, ultimately it will end up into a biventricular involvement. That is a heart failure. So your heart is not able to pump enough blood to meet the metabolic and tissue demands of the body. So the signs and symptoms related to heart failure are because of three reasons. One is patient has low cardiac output. When you have low cardiac output, you have easy tiredness, easy fatigability, early tiredness, general weakness. These are the low cardiac output symptoms. And then because of the pulmonary congestion, because of the pooling of the blood in the lungs, you get breathlessness. That is second. Third is systemic venous congestion. Patient will have ascites, patient will have edema. So heart failure related symptoms and signs are basically because of three pathogenic mechanisms. One is decreased cardiac output. Second is pulmonary venous congestion. Third is systemic congestion. So these are the three main causes of the production of signs and symptoms. Okay, what is the commonest cause of heart failure? There are many causes of heart failure. I say some within the heart, some outside the heart. Commonest cause of heart failure is your coronary artery disease, CAD. Coronary artery disease is the commonest cause of heart failure. So practically any heart disease, you take any heart disease that can lead to heart failure if it is not taken care of early or properly. Any heart disease, be it a myocardial disease, be it a coronary artery disease, be it a valvular disease, be it a pericardial disease, whatever heart, almost all cardiac heart diseases can lead to heart failure in patients who are not getting proper treatment. So therefore, there are some reversible causes of heart failure. There are very few. Heart failure, I said, it's a chronic progressive disease. But exception for this rule is there are some diseases which are reversible. For example, if somebody has anemia, severe anemia, say for example, we have seen anemia of 1 gram also in some patients with heart failure. So when your hemoglobin comes below 5 or 4, because of hemodilution, patient will develop symptoms of heart failure. So in these patients, heart failure secondary to anemia, severe anemia, if you treat anemia, if you give blood transfusion, other thing, the heart failure is reversed. So except few small, like beriberi, deficiency of thiamine, or alcoholic cardiomyopathy. So except these few things which are reversible, most of the heart failures are irreversible. So to identifying the cause of the heart failure is therefore important. You don't say that this heart failure, it is irreversible, we cannot treat. No, you find out the cause. For example, postpartum cardiomyopathy. A pregnant lady after delivery, this lady may develop heart failure because of postpartum cardiomyopathy, which is reversible. So first of all, whenever somebody is coming to you with heart failure, you should try to find out, investigate for the reversible causes in this patient. If you don't do this, they will go into chronic stage and then it becomes incurable. So as I said, there are many non-cardiac diseases which can cause a heart failure. So the heart failure, what are the risk factors? Heart failure increases with the age. As the people are aging, the heart failure. So between 50 and 59 years, 1% of population between 50 and 59 years will have heart failure. And 10% of people between 80 and 89 years will have heart failures. So that is the statistics. And the prognosis of the heart failure, though it is poor, it depends on the cause. Even your valvular diseases, aortic stenosis, aortic regurgitation, mitral regurgitation, they can also cause heart failure. So it depends on what is the etiology of heart failure. If it is treatable or curable, or if it is not treatable. So you have to differentiate, we have to identify for a curable and a reversible cause. And the prognosis also depends on the underlying cause. So if you come to pathophysiology, this is simple. The heart is not able to pump enough blood out. That is one simple understanding. What is the meaning of heart failure? Heart is not able to pump enough blood outside. That is a simple understanding. So with this base understanding, you develop the other remaining parts and then you understand the whole subject of heart failure. So the pathophysiology is the cardiac output is low in the heart failure patient. Cardiac output, because your heart is not able to pump blood outside.